everyone, thank you for your insights and perspectives this week. Debating for and against similar nurse-to-patient ratios in acute versus long-term care facilities is very near and dear to any of us who've worked frontline in the field of nursing. We've all been placed in situations where we felt our staffing levels are unsafe and impractical, which has inevitably created multiple emotions, and at times we feel we are failing our patients, our teams, especially when miscare occurs. Over time, this leads to burnout, compassion fatigue, high rates of turnover, along with a multitude of other issues. In both long-term care facilities and acute care facilities, there is without doubt a requirement for adequate staffing. But is it really necessary for them to be similar? I would disagree. Patient care delivery should be based on patient dependency, illness, workload, and scope of practice, rather than a blanket numbers game. Acutely ill patients require more one-on-one nursing care in comparison with long-term care patients, as their need requirements are higher. I agree that long-term care patients are complex this day and age, but they are stable and familiar with set routines while they are in their care facilities. In comparison with the undifferentiated acute care patients who are unknown to the departments that receive them, and require an increased level of care to meet their needs. When the status of these patients change, at that point the long-term care facilities will transfer them to an acute care facility for treatment, as they are very much aware the nursing requirement has increased and the scope of practice is outside of their facilities. Over the past year and a half, the COVID-19 pandemic has identified without doubt inadequate staffing issues within long-term care facilities. But in all reality, should these patients not have been considered acute, requiring an increased level of care? In an effort to control the spread of the virus, these patients were kept in their facilities, but certainly an increased nursing presence in this case was warranted. On a continual basis, I don't think similar nurse-to-patient ratios are in fact necessary. Long-term care facilities do need adequate staff such as licensed practical nurses, personal care attendants, and registered nurses, but certainly not similar to that of acute care facilities, as the skill mix and scope of practice between both facilities are gravely different. Being from an acute care world myself, I've been faced with inadequate staffing when considering the needs of patients and have had 1-to-3 ratios with 3 intensive care patients, but I would never think that this will be required or considered for long-term care facilities when patients are differentiated, stable, and essentially residents of these facilities. I challenge you to provide justification as to how it would ever be necessary comparing nursing scopes of practice alone for a long-term care unit to have similar nursing ratios as a medical surge unit, emergency department, or an intensive care unit. Thank you.